Okay. So if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
As the patient is born, I will manage this patient according to the advanced life support protocol.
Okay.
Uh, have a look following the A, B, C, and D protocol, in which I will look in first of all, I will look for the airways to look
Yes.
for the signs of burns and inhalational injuries.
Yes.
And as this patient is having already soot in the nostrils,
Yes.
and there is that the patient have airway edema. So I'll consider intubation in this patient where the patient
Okay.
there is already airway edema has developed. Then in breathing and ventilation part, I will I will particularly see whether the patient has a tracheal or pulmonary burns that will impede the effective gases exchange, as cutaneous burns can lead to the scar formation, and that will hinder the ventilation. And in circulation, I will insert two white book canvas and start the crystalloid supplementation with the following the Parkland's formula.
All right. Okay. Can you please tell me how would you take care of the nutritional status of this patient?
Well, first of all, I will insert the center line.
Yes.
Then I can, by center line, I can start the feeding in within a 48 to 72 hours of starting the TPN. That includes that nutrition should include high low carbs, low carbohydrates, and high fats diet. And it should also include anti-inflammatory contents like like
Why, can you please explain the scenario? Why is it important to keep the fluid restrictions in this particular patient?
patient because patient may have a, pulmonary edema, or the patient
Yes,
may
very good.
lack. Yes,
Or it can result in pulmonary edema as part of the complications.
yes, we should not overload the patient.
ARDS complications, I have to say. Okay, good, very
Yes.
nice. All right. Can you please tell me, right, can you please tell me, right, one more thing. If this patient, if you look at the patient's degree of burn,
Yes,
how would you calculate the percentage of burn for this particular patient?
uh, it is almost around uh, like 60% burns, 60 to 65% burns, because if I'm calculating at the
Which
phase,
formula are you using to calculate
I'm using
the degree of burns?
Well's rule of nines
Yes, okay.
to calculate the bonds over the phase. I'll consider like half, like 4.5%, and over the left over the trunk is 18%, and over the left arm I have considered at a 9%
Trunk
burn, and over.
trunk is 9. Okay,
Okay,
the tummy and 9, 9, 18. Okay, right. Good. You're counting the chest and tummy all together.
yes, ma'am, trunk,
Okay.
and then both the thighs I'm counting as a 36,
All right.
including
Yeah, both.
all the night.
Yes, and left arm. All right. Okay, approximately. But this is second degree burn. Can you please tell me where would you manage this patient?
I'll manage this patient in intensive therapy unit,
Okay.
intensive treatment unit, ITU.
Why not you will shift the patient to the burn unit? What is the criteria to move the patient to the burn unit, in other words?
Yes, right. Ma'am, the patient is having more than 15% of total surface area, burn surface area, and in children it is more than 10% of surface area. The patient is having burns over the perineum, genitalia, face, and hands,
Mm.
and there is a concomitant inhalational injury. There is
Okay.
electrical burns,
Yes.
with burns with multiple comorbidities, and there is a hydrofluoric acid burns, and there is a suspicious burns those are non-accidental burns.
Okay. If you fail to manage this patient on time, what are the complications that you should look out for, or do you expect
The,
to see in this patient?
the patient may have the burns shock, and the hypovolemia, the patient may develop ARDS, sepsis, and the patient may have acute renal failure. There would be bleeding, there would be anemia and DIC that can develop.
Okay. In order to monitor the patient, what would you follow, or what labs you'll ask for?
Yes, I will send for the full blood count, urine electrolytes, and ABGs in the patient, and
Yes.
uh, as well as I will send radiological HS X-ray on the session.
Okay. Can you define the term ARDS? Adult
It is
respiratory. Yes.
it is an adult respiratory distress syndrome.
Yes.
And it is in this condition there is a respiratory failure, and the patient and the lungs are non-compliant and hypoxemic, and and they are refractory to the oxygen therapy. And there is a formation of pulmonary edema, which is due to a non-cardiogenic cause.
What is reparative phase in pathophysiology of ARDS?
In the reparative phase, there is a development of either this can lead into two phases. It can heal up 100%, or it can go into the permanent fibrotic phase.
Yes, reparative phase is that proliferative phase.
Yes.
Okay, if you'll do X-ray on this particular patient and it comes out to be like this, how would you read it? What do you see in this?
There is a bilateral chest pulmonary infiltrate, and there is effusion. CP angle is blunt on the both the sides, as
Yes,
well as airway central,
yes, and
and the bron and the cardiogenic cardiac shadow is enlarged, normal, uh, not a cardiomegaly.
notocardiomyopathy. What more? What are
And there's
these?
increase in bronchovascular markings increased.
Yes, and
Uh, and
what about the exposure?
exposure is adequate. The ribs are visible.
Yeah, okay, good. Right. Fluid therapy, we've discussed. Complications of burn, we've discussed. Right. Just 20 seconds are left. So, okay, one we can discuss that how would you categorize the extent of burn?
If it is can be divided into the full thickness burn or partial thickness burn. In
Yes.
partial thickness burns, the appearance would be red. There will be formation of blisters, and their
Yes.
sensory sensations would be present. They are painful burns.
Yes.
And in full thickness burn, they are leathery, white, and nonsense sensations are lost, and they are non-painful burns.
What about the depth of burn? How would you assess the depth of the burn?
In case of is it divided into superficial and deep burns
Superficial
so,
and then partial and full thickness burn. So
and
when
full
would it be
thickness.
full thickness burn?
When it has involved the dermis of the skin, it is
Second
called
degree
as the
burns are what? Are categorized under partial,
second degree burns. Yes, they are categorized into full thickness burn.
partial thickness.
Or
Because full thickness burn are leathery and they're white
yes,
and
ma'am.
they are desensated. That is more advanced, but this one is not that, not up to that extent. Okay, if a patient like this one, okay, you said could have laryngeal edema, so you'll intubate. How long would intubate a patient? Burn patient. How long you should intubate the burn patient?
I think when the acute stress period is present and the stress period is over, then we can consider the patient for extubation as
Yeah,
long as the stress period is
stress period
stress is
and
present.
gases exchange is improving, you can see, okay, patient can survive even without help, assistance. So
Yeah.
even on mask and gases, okay, good. And you'll, you'll give enteral nutrition after 48 to 72 hours after ventilation. So good, nice, thank you.